Dr. Salvatore Gritadoria from Diversified Hearing and Balance Services is here. We discuss the ramifications of hearing loss and what can be done about it. This morning, we're going to shift that conversation to the many varied therapy services they also offer and introduce you to Lindsay Pellegrino. Isn't that a great last name? Yeah, no relation. Love that. Speech language pathologist and coordinator of their school-age services, and of course, Dr. Sal. So good morning. Welcome to you both.
Good morning.
Yeah, I didn't know you had all these extra services.
Yeah, most people don't, but we do. I mean, we actually started off providing speech therapy, occupational therapy, and physical therapy services, and we added audiology later on.
That's great. So, Lindsay, people will come in after already being diagnosed with a hearing loss, try to get apparatus to get it corrected, and then they see you?
They can, or we actually offer services to a variety of patients of different ages. So we absolutely see adults, but we also see kids. And one of the things that we've been talking a lot about at Diversified lately is children who receive services in a school setting. So be that physical therapy services, occupational therapy services, speech therapy services, and a lot of times these children don't receive services over the summer. So families are concerned because their children have made wonderful progress throughout the year, and they want to see their children continue to make that great progress. And that's where we can help. We offer, like I said, physical, occupational, and speech therapy services, and we can kind of help guide some of these families and kids over the summer when maybe they're not receiving those services, so they don't just maintain those skills, but hopefully continue to progress towards some of the things they're working towards.
Now, you have 9 locations. Are these services available everywhere?
No, not in all the locations. We presently have the therapy services in Williamsville and Kenmore, and I think that's it, right?
Yes, those are the 2 locations currently.
And Lindsay, I just had this feeling you make it fun for the kids.
We do have a lot of fun.
Yeah.
You know, all of our therapists are licensed and certified, and we specialize in working with kids and adults too. But we like to make it fun. That's how kids learn best.
Yeah, that's great.
And I think it's important to note that these services don't have to be related to hearing services at all. So any child or any adult who has communication problems, who has problems with ambulation or fine hand coordination, those people are candidates for our rehab services. And we like to say that they're boutique services because they're done in a personal environment. They're not in a big clinic. They're in a very small clinic where we're working one-on-one with the patient.
Yeah, that would make a big difference. How would people get to you? Would they call you direct for this, or do they get referred from their doctor?
Both. So we get many direct referrals from physicians, but also people can give us a call, and they could call into us directly, and we could set up services for them.
Do they have to have specific types of insurance? Will that cover this?
Yeah, we take every insurance that's out there, from Medicaid to Medicare to Blue Cross, Blue Shield, Fidelis, all the insurances that are out there. I can't think of one that we will not take. Yeah.
Lindsay, how young children are we talking about to come on in?
I'm trying to think. My youngest patient that comes into the office is under 2 currently. My oldest is actually over 95. So we have a wide spectrum, but kids of any age who need assistance with those services we can help with.
That's great. And how long would the therapy session last?
And it's different for every kid, and I can speak a little more to the speech speech side of things. Evaluations is where we start, and then the therapy sessions are about half an hour for a session, and then it just depends on the child and kind of what their needs are, how long that may progress.
I'm glad you mentioned the ages, because I think we all tend to think school-age kids. They're not getting the therapy that they normally would get with school out, so this would be great over the summer. But my goodness, you work with them much younger. Yeah.
We do.
So they can stay with you all year round?
They sure can. These services aren't just available over the summer. They're available all year, but we just want to let families know that when their kids might be missing out on these services over the summer, there are other options out there.
So Doc, when people call the office and they're looking for these services, they should just inquire, and they'll be directed.
Absolutely, absolutely. And you mentioned ages. You know, we can even take infants. If you think about, you say, what can you do with an infant? Well, a lot of times infants will have physical disabilities or feeding and swallowing problems, and so you want to start working with them right away. And we have historically taken infants, very young children.
It's interesting, and I would never even associate a hearing issue or a swallowing issue and think of Diversified. You know what I'm saying?
Yeah, absolutely.
That's why they're called Diversified.
Yeah.
They have so many. They can help so many different. Whatever the issue is, they can either find a way to help you or direct you to somebody who can. But that's amazing that you offer these other services. So they offer physical, occupation, and speech therapy as well, and that's important to know, because I would imagine someone who's had, let's just say in this case, a hearing loss would need those services. Sometimes other things start to fall short if you have had that for a while and you don't realize it.
Absolutely.
Yeah.
There's a whole therapy called oral rehabilitation, A-U-R-A-L rehabilitation. That's for people who have hearing problems and who have lost the ability or diminished ability to communicate. You know, and a hearing aid alone just doesn't fix it. They have to learn to communicate again.
Well, that's why we have Diversified Hearing and Balance Centers. These people are incredible. Lindsay, thank you for sharing what it is you do. You can tell it's a passion of yours.
It really is.
People
we all love what we do.
Super good hands when you're going to call Diversified, everybody. Again, 9 offices around Western New York. Diversified Hearing and Balance Services. They're here for you. 9 locations in Erie, Niagara, and Wyoming counties. Please give them a call at the main number, 871-9915, and or log on to diversifiedhearing.com.